Okay, I'm Craig Hunt. I'm a Royal College veterinary surgeon, recognised specialist in zoo and wildlife medicine. I see a high proportion of rabbits with dental disease in both first and second opinion. And today we have a day course with Central CPD covering the etiology, prevention and treatment of rabbit dental disease with a wet lab covering basic techniques from molar burring and coronal reduction to incisor and molar extraction, as well as touching on some abscess surgery. Obviously, we're going to look at the skull. We want to palpate all along here, okay, around the lateral aspect. There's a big masseter muscle here, so we want to palpate over that for sort of swelling. Quite a reasonably commonplace for an abscess, but also the ventral aspects of the jaw. So all along down here is where all your tooth roots are. Or in health, that's where your tooth root's going to be, so we can feel for any sort of lumps, bumps, reaction to that. But you really need to get your finger in here as well, so really kind of get under here. And then go palpate all around the eye, so that's the sort of zygomatic arch, facial process, so the premolar tooth, so second cheek tooth root kind of sits in here. Okay, you can see that on the radiographs we'll show later. So if there's an abscess of that, often there's a reaction to palpating here. Premolar 1's root's about here, so again if there's an abscess of that, you may be able to palpate that, or if there's an abscess and you squeeze it, it may find pus comes out somewhere else. So we want to palpate the whole skull, not just focus on this little bit and a bit around here. You want to do the whole thing. I've had some abscesses pop out at the top of the skull, up here. Okay, so they're not necessarily where you think they're going to be in every case. Okay, so 2 rabbits. So everyone happy with this normal? Yellow teeth normal in a rabbit? How many rabbits do you see with yellow teeth? Yeah, okay. It's actually pretty uncommon, so they should be white, but equally we do see some with yellow. So the dagoos, chinchillas tend to have yellowy orange teeth, guinea pigs white teeth, rabbits mostly white teeth, but we do see some with this discoloration. If that's the only problem, just that uniform discoloration, I'm not worried about that. Okay. It just seems some rabbits have it, some don't. So what we are looking for, so lower incisors have no ridging, upper incisors have this vertical ridge going down here, but they shouldn't have any horizontal ridging. That's got very, very faint horizontal ridging on there, if you're very magnified. So you can have this single vertical ridge here, no horizontal ridging, and no ridging on the lower incisors at all. And then when we look, you need to look at the side, so don't look at the front aspect, so look at the front, then also turn the rabbit sideways and look at the side lateral aspect and just check. Obviously you should have this nice sort of chisel shape to the teeth, and so they're nice and pointy, so not flat, and at rest the lower incisor kind of just rests just behind the upper incisors, kind of on where the peg incisors would be. Okay. Also at the same time we're looking at the nose, the nares for any sort of discharges, foreign bodies, etc. So this is an asleep rabbit using an endoscope. So try and depict what you're going to get with an oroscope. You're never going to get this picture with an oroscope. If you do, then you're doing very well. But I'll just give you what we're trying to look for. Obviously, with an oroscope, you're just going to see little aspects of it like this, a bit there, bit there. So, but that should be the full picture we're trying to get a look on. But in practicality design, you're not going to see all of that. But you're going to look at obviously the palate, the tongue. There's the lingual mound sort of here. When you're using an oroscope, and the rabbit's kind of chewing on your oroscope like it's a water bottle, and the tongue's going backwards and forwards, you might see a big flash of red when you're doing that. It's important not to mistake that for blood. There's a huge sort of vascular plexus laterally on the caudal aspect of the tongue, and as the tongue's going backwards and forwards with your oroscope, you just see some red. But again, just don't over-interpret that. Interpret that as hemorrhage. So what we are looking for, I said everything's nice and uniform, so all the molars are in nice sort of alignment there. No one's kind of sticking the head above the parapet. Everyone's kind of nice sort of uniform sort of lines. Again, that's kind of closer with the maxillary arcade, so everything's nice and uniform. There's no soft tissue damage on the tongue or the buccal mucosa, and we're going to go on to that actually in a minute. So they're all nice there. What about these ones? This is the mandible. Everyone happy that's normal teeth, or some of us thinking that's dental disease? So if you had that asleep and you're saying that, are you going to file those off? Or what are we going to do? Yeah. So what about this case? Is this one normal? Is this one normal?
Very uniform back and the front.
Yeah. Yeah, good. Yeah, so what we actually do, I see quite a lot of second opinions, and I'll see lots of cases of rabbits like this that have had several dentals because they keep going off their food. People do the dental, rabbit gets better, therefore their dental must have done the trick. Actually, they're completely normal, and what people are often doing, often on the history, it nearly always says, check teeth, few points, not convinced it's dental disease, but did a dental anyway. That's the one thing we do not want to be doing. As soon as you do a dental on this, you're filing all those off, smoothing the teeth down. You then actually inhibited the rabbit's ability to chew. Best case scenario. Worst case scenario, you actually could induce some dental disease. Okay.